Erectile dysfunction is not just a quality of life issues. For many men, it impacts their mental health, relationship, and self-worth. When medication and injection fails, penile implant surgeries becomes a definitive long-term option. But before you consider it, there are many important facts, research findings, and patient reality you must know before opting for a penile implant surgery. Now, as per 2024 data update in the Journal of Sexual Medicine, over 25 to 30% of the men with moderate to severe erectile dysfunctions do not respond adequately to oral medications. And the most common causes includes diabetes mellitus, history of previous surgery, mainly radical prostate surgery, or pelvic trauma, or Peyronie's disease. What set penile implants apart is control, discretion, and permanence. Unlike the pills or the pump, this is a surgical solution that restores spontaneity without ongoing medical intervention. The three-piece inflatable penile prosthesis is the most advanced form and the natural filling options, offering excellent conceivability and user satisfaction. Modern implants like the AMS 700 and the Coloplast Titan Touch uses antimicrobial coatings such as Inhibizones and hydrophilic PVP to dramatically reduce the infection rate, currently less than 1% in high volume centers. A 223 multi-center study which was published in Urological Practice showed that 91% of the patients reported high satisfaction rate, 94% of the partners were satisfied, and mechanical survival of such device is more than 90% at 10 years of age. Even in diabetic patients, overall success rate remains above 85% when managed by experienced urologists. Now let's clear the air, the myth and the fact. Myth is the penile implants are only for the old men. No. Over 22% of the men undergoing penile prosthetic implantations in the recent years are below 50 years of age. Now the another myth is it looks like fake or mechanical. Now the fact is inflatable penile implants provide both rigid erections and natural flaccidity when deflated, which is invisible to the others. Implant reduces sensations or orgasm, but the fact is sensations and the climax are totally unaffected. In fact, many patients report improved sexual confidence and partner intimacy. Now the other myth is it is irreversible. The fact is it is replaceable. If malfunctions occur a year later, the implant can be safely replaced with a new one without major issues. While penile implant surgery is generally considered safe, it may not be suitable for all individuals. Certain medical conditions or factors can make the procedure inadvisable to them. It is essential to consult with a healthcare professional to determine if this option is appropriate for your specific situations. Like active urinary or systemic infections, if you have a very poorly controlled diabetes and the HbA1c is more than 9. In cases of bleeding disorders, it is not advisable. Potential complications includes like temporary swelling or discomfort, mechanical malfunctions which are rare nowadays, scar tissue formations in Peyronie's disease cases. Now let's talk about the recovery timeline. 2 to 3 days hospital stay in most of the scenario. 4 to 6 weeks until full sexual activity is resumed. Regular follow-up is essential for optimal outcome. Now, minimally invasive approaches now reduces the post-operative pain and overall enhances the early recovery. A 2023 patient satisfaction survey, which was done by the andrologists throughout the world, reports that 94% would recommend the surgeries to others, and over 70% return to sexual activity within 6 weeks of the surgery. Now, 60% amongst all of them said that it improved the relationship satisfaction. One of our patients, a 39-year-old Rajiv, struggling with the ED post-prostate surgery, after his inflatable penile, he described it getting his life back without the stress or side effect. These are not isolated cases. Such experiences are becoming the new normal with skill hand and tailored counseling. Now, the penile implant surgery is not a last resort. It is well-researched, high satisfaction treatment for men who have exhausted medical therapies in all. But do not decide based on fear, myth, or peer pressure. Instead, get evaluated by a trained urologist. Ask about device options, so what are the different options, whether it's a malleable, whether it's inflatable. Set very realistic expectations. Talk to real patients if possible. Hi, I'm Dr. Arif Akhtar, and we provide evidence-based, personalized care for ED, including counseling, diagnostic, and surgery using the most advanced implant which are available today. Take control of your sexual health. Don't let myth define your life. Thanks.